Lying in your deathbed, your mind wondering between living the rest of your life or ending it suddenly, what would you choose? Debates about the ethics of euthanasia and physician-assisted suicide date from ancient Rome and Greece. The ancient Greeks and Romans believed that life should not be preserved at any cost. However, in recent years, the battle between euthanasia has grown. Euthanasia is defined as administration of lethal medication to a patient by a physician with the intention of ending the patient's life. When a person carries out the act of euthanasia, he brings about the death of another person because he believes the latter's present existence is so bad that they will be better off dead. The role of the physician is healer. So when you totally change that by authorizing physicians to take people's lives, it alarms people. Right now, in 49 out of 50 states in the United States, euthanasia is banned. The exception to this being Oregon. Oregon legalized euthanasia. In the entire world, only 2 countries have legalized euthanasia, one of the countries being Belgium and the other being the Netherlands. But the argument among those for euthanasia and those against euthanasia is, do people have the right to choose euthanasia for themselves? And what would be the effects of legalizing euthanasia? And this, the battle between autonomy, the right to self-govern, which all Americans have, and death is presented. The people that are for euthanasia say, yes, in this country we have the right to autonomy, but where should the line be drawn? In comparison to murder, it is your own self-right to want to kill someone unjustly. However, it's against the law to murder. And to most, murder is immoral. So what about euthanizing someone? How does that compare to murder? Those that are against euthanasia say that the cons outweigh the pros if euthanasia is legalized. They question that every person euthanized will be so justly. The terminally ill is a class of persons who need protection from family, social, and economic pressures and who are often particularly vulnerable to such pressures because of chronic pain, depression, and the effects of medication. With the pressure of financial bills and their heartaches and wasted time, the patient might feel that it is their responsibility to relieve the suffering from their family. For those people that may feel that way, is it right to give them the right to choose euthanasia? Will they do so solely based on this reason alone? Will their rationale be just? Dr. Death, better known as Jack Kevorkian, was arrested for euthanizing more than 130 people. Jack Kevorkian was arrested and charged with second-degree murder of Thomas York, who was suffering from amyotrophic lateral sclerosis, better known as Lou Gehrig's disease. Thomas York asked Kevorkian to end his life, and Kevorkian complied by injecting him with poison to stop his heart. Jack Kevorkian is a former medical pathologist who supports voluntary euthanasia. He became famous in the 1990s for his death machine, device he invented that allowed a user to self-inject an anesthetic that then a lethal dose of potassium chloride. He called the machine Thanatron after Thanatos, the figure of death in Greek mythology. In September of 1998, he videotaped the death of Thomas York. The tape was broadcast to CBS television show 60 Minutes. In November, Kevorkian ended up in trial again, charged with murder and the delivery of controlled substance. With this horrific example, how could anyone believe in euthanizing someone? Although I believe in patient rights and autonomy, I do not believe in murder, whether it is on your own self or not. no one should have the right to kill. I believe it will produce a snowball effect where no one will be able to decipher between euthanasia and murder. There will have to be superior security measures taken to ensure that the patient truly agreed to euthanasia. Euthanasia should not be legalized. The battle between autonomy and euthanasia has ended. Thank you.